Hi, I'm Chip Myers, a paramedic with the City of Alexandria Fire Department in Alexandria, Virginia. Next, we're going to talk about how to treat common extremity fractures. We're going to start off with a fracture to the arm. Here are some of the equipment that we can use. Board splints. You can also, if you don't have a board splint, you could also use a newspaper, a magazine, or a small book. And you just wrap those around the arm, and they would provide enough stabilization. Here our patient Josh says, ow, his arm feels like it's broken. He felt a snap or a pop. When looking at the arm, you see that there's some swelling, there's a lot of pain. The patient may also have feels like there's a extra joint there, or they feel like there's something grinding in there. So what we're doing is stabilizing the arm, and you can have the patient assist you if need be with the board. And then we're going to tie the wrist and the elbow area to the board. Now you want to tie it firm, but not so firm that you would shut off the circulation. If you tie it too tight, the patient may complain of numbness or tingling in their fingers, and you'll notice that their finger starts to change color. If this happens, you're going to want to loosen up the board. Notice that the arm is now immobilized, and this should minimize the pain the patient's suffering. Next, we're going to apply a sling and swath to that. A swath is sort of a triangular bandage that keeps the arm upright. If you don't have triangular bandage, you could use other things around the house. You could use a handkerchief, a scarf, a bandana. And what we do is first tie a knot into the corner, and that makes a little cup for the elbow. Then we bring one end up against the chest, bring it to one of those triangular ends to one side of the neck, bring the other triangular end to the other side of the neck, and we're going to tie that behind the patient's neck. If you have something handy, some more cloth or padding, you can stick that behind the neck so that the knot isn't pressing too hard on the neck. We would then tie that sling off using another triangular bandage or roller gauze, anything you have, just to keep it from flopping around. And that's how you would stabilize a fracture of the upper extremity. Next, we'll talk